Hello everybody, we are back, VIDA Integrative Medicine and Monday Night Mythbusters. Thank you so much for joining us.
Thanks guys.
I'm Dr. Carolyn George and this is Leslie Harrington, Transformational Health Coach. And tonight we are going to be talking about why functional medicine rocks. Okay, so we want to kind of dive in a little bit. First, I'd like it if everybody that's chiming in could shout out if you have a functional medicine practitioner already. If you do, just give us a thumbs up and maybe let us know. Hey, Kristen, let us know if what type of doctor. Is it a doctor of chiropractor, a DO, an MD, a naturopath, a nutritionist, a pharmacist? There's all different kinds of practitioners that do functional medicine. So please, Brian, thank you. Hi, Marianne. Hi, Michelle.
Hi, Marianne.
So chime in and let us know. And if you're looking for one, we've got some great ideas for you on how you can find one, because it does take some time to find just the right one. And there are many different ways of practicing functional medicine, just like there's many different ways of practicing conventional medicine. So it's really important that you find one that jives with you.
Hi, Sadine. I think, it's funny because I think a lot of the people that have been really religious about tuning in, which thank you for that.
Yes, thank you guys.
We assume everybody kind of knows exactly what it is that distinguishes functional from traditional or conventional medicine, as you would say. And there is some crossover there. There's actually where you could get the best of all worlds when you're dealing with someone like Dr. George. So, Sally. So, yes, definitely, kind of giving you an idea. We're going to go through just how you distinguish what it really means, and then how to really seek out somebody that's going to be the most effective for what you're looking for. And then, of course, some of the things that would be red flags and things you want to avoid.
Absolutely. So first thing, functional medicine is different from integrative medicine, but often functional medicine providers also do integrative medicine. So integrative just means that that practitioner integrates different modalities. So they might bring in Chinese medicine and some acupuncture, they might use some Ayurvedic medicine, they might use nutrition, so they can bring in different areas, but they don't necessarily practice functional medicine. And functional medicine is that looks at the function of the body. Not so much broken up into organ systems, which is the way we look at it in conventional medicine, but more in terms of how it functions, like energy, digestion, repair, your movements with your joints and your bones, communication, which is how the body communicates through hormones, and not just sex hormones, but your insulin, your adrenals, your thyroid, ghrelin, leptin. There's probably 100, steroids, your many different hormones. So functional medicine is looking at the function of a body, and that helps us to, it's a way of kind of processing what's going on. It's not so much diagnosis oriented as conventional medicine. Conventional medicine really hones first in on getting that diagnosis, and then there's usually a protocol for treating that diagnosis. In functional medicine, we're really looking more for what's the root cause of the imbalance. So we're not so concerned about figuring out exactly which autoimmune disease you have, but the fact that your body is starting to fight itself is more the key thing. And so we really want to look at that bedrock, the foundation, and those are key things. So we will look at your diet and the mood that you're in when you're eating, not just what you're eating, but how are you eating it, your sleep, how you move your body, toxins you're exposed to, the water that you drink, is it clean, is it enough? So we're really looking at the things that help to create health and helping to figure out where in your world is that out of balance and what can we do to shift it.
Yeah, I think it's really more true healthcare. It's less of sick care, and it really gets away from that crisis care, which is actually, some of the conventional medicine, that's really the acute care is such a powerful aspect of that. But they're not looking at you as as a whole system. They're looking at parts within the system. And when you start to look at parts and you kind of lose track of how they're all running together as like this well-oiled machine, you start to disconnect and really see what's going on. So, you could have a root cause or something that might be a root cause, but it might not also be the same as that trigger. So a trigger and a root cause can also be different. So we're looking at all aspects of that. They're not addressing, the nutrition and the pieces like that. That's just not what they're trained to do. And if anything, they actually can be criticized by that, by making any type of recommendations.
Right. It becomes a challenge because their colleagues aren't doing that. So, so conventional medicine, awesome for what it does. I still really promote conventional medicine because if you have a heart attack, if you're in a car accident, there is nothing better. Functional medicine is not going to fix that, okay? But functional medicine can help to create a healthy body so that if you are in a car accident, you can recover faster, and it can help you with post-op recovery, with cancer recovery, with that type of thing. So,
or long-term impact.
Long-term impact, yeah. Both have their place. I don't think we can do one without the other. So we really have to learn how to coexist and how to augment each other's practices. And so with my years of experience in the ER, I know just how important that is. But with my years of experience in the ER, I know how to try to prevent you from needing the ER other than for accidents, for example, yeah.
So after hearing a little bit of this, guys, I know some people have already worked with us, but how is that clear to you? Were you kind of understanding the difference? What made you seek out, more of a functional model than what you were seeing with traditional medicine? Some people were either finding they weren't getting what they needed from conventional, and other people might have just stumbled across it. So right. We're trying to understand a little bit there. Brian says the conventional doctors laugh at my supplements and feel like they are trained to treat. I got cut off, Brian. I can't read the rest. Hold on.
Yeah, but that's absolutely true. They are really trained to look for that diagnosis,
and
they feel, and I don't have a big issue with their concern about supplements, because I tell people that every day. There's a lot of supplements out there that are junk. And so you need to know what you're looking for. You need to have the high quality supplements. So in the conventional world, they just see everything like we might see a Centrum or a really kind of cheap vitamin, where it really is just draining your pocketbook. But when you use them appropriately and good quality ones, then they can be, astounding in terms of their effects and balancing your system. So many of my patients already know that.
Yeah, and then there's, of course, if you can name it, you can treat it.
You can blame
it. As a pill for an ill. You can blame it, and you can put a code to it.
Right.
Which, there's a lot of insurance implications there. So it's a little bit different, too, which leads us to go into the idea of what not to look for and what not to be contingent on whether or not you work in functional medicine. One of them would be, are you considering it because of the free consult, or are you considering not doing it because of insurance coverage? And those are where some people need to really look beyond that and understand where insurance begins and may end in some of these.
Right. So I always ask people to think about it this way. Insurance is more disease care. So if you've got an illness, something that they can give an ICD-10 code to, then that can generally be really useful. But if you're looking for health, then they're not going to be so useful. They're really not into preventing. Insurance will not pay for prevention. And until insurance companies take you from cradle to grave, they're not going to really be interested in prevention. So the analogy is like if you've got a beautiful home and you only did what insurance paid for in terms of renovations, you'd never renovate it, right? You wouldn't upgrade the floors, the carpets, the windows. You wouldn't redo your kitchen and your bathroom. And after 10 or 20 years, you know just kind of how dilapidated that could look. So think of your body that way, or like a car. Again, if insurance didn't cover your oil changes, would you not do them? No, right? You'd still do them because that's basic maintenance.
Basic update.
Yeah, so your body is the same way. You need to feed it good fuel. You need to give it good sleep. You might need some good supplements. You're going to certainly need a practitioner that understands the imbalances and kind of how to create health, and how to help you get motivated to do the things that you need to do. And that's really a big part of it. So disease care, health care, two very separate things. They can absolutely coexist. So for example, There are naturopaths that work with cancer. And so they work together with the oncologist to make that body best able to tolerate the chemotherapy, and then to go on to health. There are doctors like myself, we work with SIBO, so I like to work with other physicians, but I'm looking at the body from a different angle, and so it's good to understand that I'm not going to be replicating what your conventional doctor is doing, nor she what I'm doing. So we each have our place in your kind of whole healthcare model.
Yeah, and I think that distinguishes complementary care from alternative care, right? So alternative care, sometimes people misunderstand that to mean that complementary in some ways, and in sometimes alternative is going to be a treatment that's just fully independent of something that you're working through, or it's the only thing you're doing. So if you are, for instance, diagnosed with cancer and you decide you're not going to go the traditional route or conventional route at all, and you just move over to any type of alternative treatment, which wouldn't be complementary or adjunct, right? Complementary is what you're looking as kind of having the best of all worlds. You've got multiple eyes on the case. You've got the person that is looking at the individual situation, and everyone might the best oncologist in the world. Yes. Now that person's going to focus on that, where you've got your functional team that's going to keep your body prepared and strong and supported throughout that process.
Exactly. So I don't really like that term alternative, because I don't consider myself an alternate or away from. I'm very much vested in physiology and research and all the basic sciences. But I'm just approaching the body a slightly different way. I'm looking at the whole piece, and I'm looking at the person's whole life. We sit down and do a timeline and look at what things have affected them.
Yeah, and the pieces to that timeline are critical to really understanding like the dynamics in their life and the stressors and the triggers, like I mentioned. There's some things that could happen a very long time ago that don't seem like they'd be relative to how you're feeling today, but they definitely contribute to
relevant.
Yeah, where your body's at now, right? One of the other things we talked about in the letter and the announcement was Cleveland Clinic, and how Cleveland Clinic's functional medicine department has just exploded. And they are kind of pioneering from a hospital standpoint when you put functional medicine in a setting like that, and Dr. Hyman's kind of spearheading that. And they've just it completely exploded. So they've doubled their size in the last few years. And not only that, they have a ridiculous 1,100 count at least patient waiting list, which is kind of absurd if you think about it, But they are expanding, and it's primarily in Cleveland. I think that they're still a little bit stuck in their little area of the world, but hopefully some of the thinking and the mindset is trickling down.
And so one of the things, the Cleveland Clinic's doing a great job, but they're really trying to make this work within the insurance model to see if you can save money by doing it this way. And I think you probably can once you get all the working pieces together and get the appropriate players, getting the health coaches and the nutritionists and everybody kind of orchestrating and working together. So that's one of the reasons it's so popular, is because it's within the insurance model. So that people aren't spending that money. But again, I come back to, really, you want to look for the investment. You want to think of yourself as a beautiful Lamborghini, or your $1 million home. You've only got one body, and so it really behooves you to take responsibility for it and take care of it long term, right? So that's where you put some money into it yourself, but the benefits, the ROI, the return on investment, is huge in terms of staying away from hospitals and needing surgery and having heart attacks and needing medication, missing days off work because you're always sick with a cold or feeling lousy.
It adds up.
It adds up, and it adds up pretty darn quickly. Because what I do, what any good functional medicine practitioner does, is teach you how to take care of your body so that we have a long-term relationship. You kind of go back and forth, but really you're becoming your own doctor. You're figuring out, okay, well, this is what I need now, and I need more of this, or I've given myself less of this, I'm going to have to do this. So you start to really tune in and take responsibility for your own health, which is number one in terms of functional medicine practices.
Well, and I think the hospitals or the traditional is a little bit more assembly line. You're kind of just a cookie cutter, and in our world, it's very individualized. It's very personal. Not only are we helping you to empower yourselves, actually, to be able to be insightful and in tune with your body, and not just hand you a medicine bottle and say, you know, come back. And you're responsible in coming. You can, once you know better, you have to do better, right? And if you don't, you can't really unknow what you've learned. So even the people that come in here, they know when they're not doing what they should be doing, because most people at least give it a try and feel better, and if they don't maintain it, they kind of know where they're falling apart. But knowing that it's so personal, there's not one person that comes in here that has the same story, that has that same timeline, and so everybody has a different direction. So you're never going to get that in a doctor's office and have them really truly look at you as a person in everything in your world, instead of just, you know, whatever you're presenting.
Right. And it's not that they're bad doctors. It's just that they're working within the confines of a system that hasn't taught them that, and doesn't allow them to, even if they're learning about it, because it's so regimented right now. So there's some great doctors that are out there in conventional medicine, but they really are very limited to what insurance covers and what their particular group that they're with lets them do, and what their colleagues are doing, so they don't want to get sued. You know, there's a lot of variables that really keep them in a bit of a bind. And so in functional medicine, patients kind of understand that there's a little bit different relationship, and like you say, we're all about empowering them and putting the responsibility back on you. I know it's sometimes uncomfortable, but it really does boil down to what you do, and then you can take the credit when you do all these good things. You can say, yes, I did that, and we're here to help and support you, and we create that team so that you've got somebody, whether you need a therapist, a health coach, a massage therapist, a acupuncturist, a lymphatic massage person, whatever kind of support you need, we figure that out, so that you've got a whole group of people behind you. You're not seeing them you're not seeing them every week, but you know, should you need them, you've got somebody. There's somebody's got your back to help, to hold you accountable, to give you the support, to tell you how to make this a little bit easier, to give you some tricks.
Yeah, and with that, you know, what are some of the things that you want to look for and kind of make sure that you're protecting yourself from? There are functional medicine doctors out there that might not be exactly everything that you need for you. So I've seen a lot of people, especially around here, it's tough to find a good doctor around here. It really is. And I know the few that people, they hop around a little bit, you know. So what are some of the key things to look for?
So one of the first things I would say is do due diligence, check reviews, kind of look at what they've got on their website, what blogs they've written, kind of see if they're approaching your particular problem, because everybody has kind of some areas that they see more of, although in functional medicine you can apply these processes to everything, but you want somebody that's going to be comfortable with what you've got, what issues you've got, and then make sure that you can sit down with them and feel comfortable. It's often good to go in and do a first appointment. I offer a complimentary 15-minute appointment that we can talk on phone or in person.
Get kind of that vibe.
So you can get the vibe, because I'm not for everybody, and I understand that, and that's okay. But there will be somebody out there for you that's got your kind of, that has got your vibe or your approach, or you just feel like you connect with, because that's really important. Because I like people to ask questions, and if you don't feel comfortable asking questions, or you don't feel confident in the skills of that person, then you shouldn't be in their practice.
Yeah, you have to believe in the process, and you have to believe in who you're working with. And you get that connection in that initial conversation, at least, you know. And so you definitely want to have that. You also want to look for somebody who's going to absolutely address nutrition. You know, most people are, there are a lot of testing that is available in the functional world that traditional and conventional doctors are just either not familiar with, they're not trained on. It's just not part of their diagnostic specs, right?
Yeah,
but they, you know, you will have that opportunity to test, but if the person's only doing testing and they're not discussing some of these other things like nutrition and sleep and stress, and they're not covering some of the really key things that can be the biggest needle movers in your changes.
Right. So they should definitely be talking to you about a whole plant strong, organic as much as possible, maybe even grain-free or gluten-free. So they really need to put some emphasis on diet They may use supplements, but that shouldn't be all that they do. They should definitely be talking about sleep and stress management. And it may not all be in that first appointment, of course, because you can only fit so much into one appointment, but they need to at least convey that that is part of the long-term process. So that's another key piece.
Yeah, and the testing is critical because it's like shooting at a dartboard. You know, the testing is going to give you so many pieces to a really big puzzle.
Right.
And so from an affordability standpoint, you know, sometimes it's not always more is better, but the strategic ones that are very specific to what you're presenting with are going to be powerful.
Yeah.
And so making sure that, you know, if you have the option that they're going through, you know, hey, if this is what your resources are, this would be the one that's going to give you the most information and that's most relative to you.
And finding the balance. Somebody that does not do any testing at all, I would be very nervous about because they're just guessing. And they may be guessing based on years of experience, but it's still a guess. And I'm very big on testing and making sure that the companies I test with are good quality companies that are consistent, and then retesting to show that you've improved it. On the other hand, you don't want somebody that just does these super expensive tests and throws all your money away at them. So sometimes there are things you can do within your diet or your activity or your stress management that you could do first before you do some testing to see if that moves the needle. Like I'll often start people off on a detox diet just to kind of clear the stage to see just exactly what do we really have to work with once we take out alcohol, sugar, coffee, gluten, and dairy. So finding that balance again, tests are good. I really like them, but they are not all that there is to do.
Yeah, absolutely.
Yeah. And one of the other things that I think is really important is when you're sitting down with them that you should not feel judged. So you really have to feel a kind of warm, open communication and know that you can ask them anything, because if you're lying to us, if you're telling us what you think we want to hear, that's not helping you at all.
Absolutely. And you're getting the time. Yeah. You're getting a huge value in getting somebody with an MD to sit for 90 minutes in some cases, 30 minutes, an hour.
Right.
That's just not the kind of interaction that you would get in a regular, family practice.
Right.
So really being able to use that time effectively and be able to share like really good details that are all, again, putting the pieces of the puzzle together and helping you to kind of see what's really going on and help you progress forward. It's a longer term relationship too, in the sense of progress. Not a long term just because you're coming back repeatedly, for med refills or whatnot. So there's a different dynamic there.
Yeah, and I always tell people this is a marathon, not a sprint.
Yes.
So people will come in and think after 1 or 2 visits that they're going to get rid of decades of ill health because they started to do something positive. Well, yeah, a month will help make you feel better, but if you've been doing a certain behavior for 10 or 20 years, a month is not going to undo that. So you really have to realize that it's a long-term relationship that we, like Leslie says, we're working with puzzle pieces. We're trying to fix this and then move this in and then see how this fits. And so there's a lot of different moving pieces that we work with.
Yeah, and sometimes when you fix one thing, the other things resist, and they're going to kind of shift a little bit and kind of want to stay at their set point. And so it's a progression.
Yes.
And you fix something and then you might look at something and shift focus because that's kind of got stable, and it's a constant
moving,
work in progress,
always,
but then what happens is you develop your own way and you start to learn how to create your own progress and to make sure that you're constantly focusing on these moving parts, and when something's off, and then that's when you kind of have to come back in and reevaluate. But for most part, you get to a place where you're pretty insightful and you're pretty in tune with your body because that's part of what we teach.
Right, and I have a lot of patients that once we kind of get all those moving pieces, those puzzle pieces together, I'm seeing them 6 months or a year, and I've got several that we're just seeing yearly because now they're kind of in a groove, they're feeling good, they kind of check in, we just make sure that things are where they should be, and then off they go and they're back out there at it. So it's not like I'm asking to see you or any functional medicine doctor is going to need to see you every month for years on end.
Yeah,
right?
It's not like
if they're doing that,
a maintenance care kind of
then
thing.
you shouldn't be with those people if they're doing that. So you get into a rhythm. I tend to see people very frequently initially, probably every month for about 6 months, and then we kind of get into that groove and we see each other less and less and less, but we've got that relationship and rapport. And that actually brings me to another point, is that having somebody that can do telemedicine can also help,
true.
because we don't always have to be together in the same room, and so that then gives you a little bit of leeway. They are doing that in conventional medicine a little bit more now too, because insurance is allowing them to get paid for certain things. But don't always look for what insurance pays for. That's not always a good indicator of what's healthy for you. But with telemedicine, it can be really relieve some of the stress, because you don't have to drive here, drive back, fight traffic, leave work early, that type of thing. So we tend to be a little bit more personalized.
And for the people that are learning, about functional medicine, that are not familiar, as they're watching this, just also understand that there is a big fight in the functional medicine world to get recognized and to have that insurance type of, how far out that is, if it ever, who knows. But it's a very important idea to have this this be taken as, the preventative medicine is, if we can continue to die longer, right, or we can live with vitality, right. And right now I think as a society we're if you look at the statistics, and we're living older and all this stuff, but we're not living, people are dying longer, right, because they have sick medication that's just keeping them alive, and it's unfortunately their lifestyle and their vitality is just it's just not really what I would consider quality,
conducive to good health, right?
Yeah.
Right. Yeah, absolutely. So there are some ideas. Now, if any of you have any questions, we've got a couple minutes left. Shout it out. Or if any of you want to talk about kind of what you found when you've experienced different functional medicine doctors, then let us know what your experience has been.
Yeah, maybe share with some of the people it's new information, some of the things that you found that have been helpful for you, and or some of the obstacles you might have faced.
Right, exactly. Hi, Nellie.
Hi, Nellie.
So, so as we close, just wanting to say we've already talked about some of the red flags to watch out for, watching for telemedicine, the key attributes of a good functional medicine practitioner. Just realize that it's a team, and that you've got to have some good back and forth. You've got to have good communication skills, but ultimately the ball's in your court. You have to take responsibility both for who you choose and the things that you do, what you put in your mouth, when you put yourself to bed, that type of thing. So it really is driven by you, and that's a wonderful thing, because then you get to take credit for it.
Yeah, and then when people look and they go, well, why do you care how much I sleep,
Right.
And like, you realize that sleep is one of the biggest things that are being talked about right now, sleep and stress, because they're associated with almost every ailment and chronic disease that's out there right now. So it's very, very important, and it's one of the things that's free, to work on it.
Right.
So, I mean, it's not easy, and there's things that go with that, but understanding what your body's doing and how you can help yourself get through that and really start to focus on that. It's a big needle mover.
It's a big needle mover.
Hi, Lillian.
Yay. Hi, Lillian. So it's a huge needle mover, and like you say, many of these things are free, right? Sitting down to eat, relaxing, doing meditation, doing exercise. By and large, you can do these all at home. You can go out for a walk. So there's so much of this doesn't cost. So it's important to kind of learn what your body needs, and have a little guide with a functional medicine practitioner and a health coach.
Yeah, no, thank you, Kristen. I'm glad to hear that, because honestly, having this process in general, it's something that I was going to say. I wanted, before we switched over, to address kind of how to distinguish some of the functional medicine piece too.
We've got a couple minutes.
Yeah, we have a couple minutes. But it's something that if you're not familiar with it, being able to go and kind of see and dabble with what's really going on in here, it's something that I can't imagine not having it in my world, and even my friends and the people in my life that have been introduced to it. So yeah, it's going to be a really cool journey.
It's powerful. Yep, absolutely. So just to close, we wanted to tell you about a few of the different practitioners that do functional medicine. So you've got medical doctors such as myself. Then you've got doctors of osteopathy, or DOs. You've got nurse practitioners, chiropractors. You've got nutritionists. You have naturopathic doctors, or NDs. You have, what am I forgetting? You have acupuncturists that have been trained in functional medicine. So the Institute of Functional Medicine is really trying to get out there and train a lot of different practitioners, different styles of practitioner, so that we can all work together and have a same common language and understand the process and the timeline and what we call antecedents, triggers, and mediators. These are all terms you start to learn as you do functional medicine. But so if all the practitioners have the same language, then we can communicate much clearer. And then we're working together for that patient.
Yeah, you'll hear a lot about, I think some people are confused by that because you might have a chiropractor and they're like, I don't know, this person's not a real doctor, they're a chiropractor. I hear that a lot, you know. And just understand that the person has a practitioner license before they're trained in functional medicine. So it's a twofold, you know, it's a very extensive training process to have.
Yes.
You know, it's not, yeah, like as a health coach, I couldn't go and become a functional medicine doctor without being an MD. Like that,
or a nurse,
or some sort of practitioner status with a license and things like that. So
but you can do functional coaching.
Correct.
Yes, yeah, absolutely. Correct. Yeah, and that way everybody's got the same language. So that is a big piece. Just look for your functional nutritionist, your functional health coach, your functional chiropractor, and then create your own little team for whatever needs you have.
Yeah. So any questions, guys, before we wrap up? And again, anything that you guys are looking at for the future for our conversations, we talked a lot about sleep and stress. We've done a lot of shows on some of that free stuff we were talking about. So meditation and breathing techniques and some of the things that are just really everyday activities that people can implement. But we are going to get more deep and more specific with, you know, stomach issues and SIBO in particular, or, you know, specific hormone imbalances. And we're going to get a little more detailed with some of the shows, but we'd like to see what people were really, you know, for now, really interested in too. So,
so shout out what your areas of concern or interest are, because we don't want to do a show on thyroid if nobody's interested in thyroid. So we really want to tailor it to our audience and who's watching. So please give us some ideas of what is important to you, and we'll try to address them. And they can be little very intense areas, like a specific cofactor, maybe why is magnesium important, or it can be something broad like what's thyroid disease. So just whatever is of interest to you, shout it out, and we will try to accommodate.
Yes, definitely. We love recommendations. So.
Okay.
All right, guys.
Thank you very much, everybody. Have a wonderful evening, and enjoy your functional medicine practitioner or your search for a functional medicine practitioner.
Awesome, guys. Have a good night.
Take care.